Hello everyone, my name is Sam Hackett and I'm one of the Sarcoma UK nurses, and I'm so glad to be here this afternoon talking to you all at the invite of the Life Raft Group. I want to talk to you about the Sarcoma UK support line that we set up in 2016. And I want to just let you know a bit about me. My background is a bit unusual. I was a sarcoma nurse at the Royal Marsden, which is a cancer hospital in London. And I did that for about 20 years. And before that, I worked on a teenage cancer unit looking after people with sarcoma. And I've been working with a charity as their nurse for almost 9 years. So I've been caring for people with sarcoma for over 30 years. So I'm showing my age now. But we're going to talk a little bit about the support line, how we set it up actually. And I'm going to try and cover what the support line is now, why did we set the support line up, and how did we go about doing it. It was harder than I thought, but we have learned so much from the people that ring into the support line. I'm going to share a bit about that. And I thought it'd be also quite useful to talk to you about what we might have done differently had we known the things that we now know, and that might be quite helpful if anyone is thinking of doing something similar. We are always available at Sarcoma UK, and I will make sure that our contact details are there. So if there's any questions that come up when you've watched this, or if you want to get in touch to talk about how we did it in more detail, please don't hesitate at all. So what is the support line? Well, the support line is for sarcoma patients and their families, but we also talk to doctors and junior doctors on the ward rounds and GPs. Every person affected by sarcoma can ring our support line. It's confidential and it's independent and it's free to everybody. And our kind of rolling philosophy from the very beginning was, we believe no question is a silly question. And if we don't know the answer, we will find someone who does. And we're very blessed by having a big medical advisory board that we know really well. And so we tap into them when there's a question that comes up that perhaps we're like, oh, not heard of that specialty or that subtype. Let's go and find out some more information on it and get back to the caller. Our support line service for Sarcoma UK is open from Monday to Friday from 10 a.m. in the morning to 3 p.m. And you can ring, you can email, or you can text. And although we are a UK charity and we are very much set up for the Sarcoma UK community, we definitely speak to people from across the world, and we spend a lot of time signposting people to many of the charities and the advocacy groups I'm hoping that are listening today. And across the world, we've spoken to people from every continent now. They only make up about 4 or 5% of our calls, but we always want to offer some information and signposting. We would never want to just say, no, we only deal with people in the UK. So we always do answer and forward people on to another charity, perhaps in their own country. So it opened in February 2016. It took 4 months from the getting it up and running and trying to work out how we were going to do it to the first phone call. And that was February 2016. And in that year, it was me running it on 4 days of the week, and an amazing girl from our support and information side who did 1 day. And we had 403 people that rang and 872 contacts. So we had emails, text messages, and phone calls. We always have said and always seen the whole time that most people will always ring us back and have a second or a third, sometimes a fourth or a fifth contact with us. And we're now at over 26,000 contacts since we've opened. And we've spoken to 5,500 individual people with sarcoma. So I wasn't quite sure if anyone would ring me on the first day that I opened the support line, but I think they have, and I think they're ringing back. So it's been exactly what we wanted it to be, and so much more. The top 3 reasons that people ring us, they change each year, but it's usually around diagnosis. There's lots of calls about diagnosis now, and that's about getting people to the right place. And also getting them through that pathway to getting a diagnosis as quickly as possible. Lots on support for the person with the disease, but also support for families and support for children. A lot around the treatment options, of course, and clinical trials. And we've always been really keen to give people the tools to be able to advocate for themselves. And so we do a lot of work in helping people kind of get their thoughts together and their understanding together. So when they go back to a clinic appointment to see the team, they come away with their questions actually answered and in a way that they understand and that means something for them. And we do a lot of signposting. I literally feel I have a little black book that I could signpost to all sorts of different things. We really link people to everything, locally where they live, nationally, or like I say, sometimes internationally as well. But why did we set up the support line in the first place? And it was a very conscious decision. The charity at the time, Sarcoma UK, was very small. We had about 8 members of staff. I think I was the 8th member of staff to join. We've just had, I think we are just on 30 members of staff now. And calls were coming into the office that were kind of increasingly difficult for people to manage who didn't have a kind of sarcoma background. They wanted more information, they wanted more support, they wanted more signposting, and the people in the office at the time didn't feel they could answer them. We also knew that 15% of people historically in the UK were definitely not being treated in sarcoma teams. We are very lucky in the UK. We have very designated, named sarcoma specialist teams across the country. And because we have an NHS, a National Health Service, people have to go to be treated in those places. So it's written down in a big piece of document. So if someone's in the wrong place, you can use that document to go, I shouldn't be here. I need to get to a sarcoma specialist team. You need to refer me. So we knew that, and we can help people do that. We also knew, and I had just come from a sarcoma specialist team, as I'd said, that the teams are under huge pressure and real limited time to spend with patients and families. I think when you're a nurse in a clinical team, you have a lot of information to give a patient, and that's really important for them to know what's coming up and how they're going to consent for things. But actually just having time to sit and listen and hear what is important for them and what questions they might have, that's increasingly hard to do. And so we were hoping that the support line could support the clinical teams by giving people more time to talk through their concerns. So the aims of the support line was to be independent and confidential, offer time and a listening ear, and provide people with those tools that we've spoken about to advocate for themselves and give accurate and useful information. Accurate information is so key to people being able to understand what's going on around them. And there's so much rubbish on Google. And we really wanted them to get the right support and correct signposting. And we, as a Sarcoma UK team, we want people in the sarcoma specialist teams. And we do that in the UK by a meeting called a Sarcoma MDT, a multidisciplinary team. Every person with sarcoma in the UK should be discussed in a sarcoma meeting. And that's our question to everyone that brings the support line. Have you been discussed in a sarcoma MDT? And if they don't know, we ask them to go and ask, and then we make sure they're in the right place. But how did we actually get this support line up and running? Well, stakeholder engagement was absolutely key, and it remains key to the way we run the support line. We absolutely wouldn't be able to do it without that stakeholder engagement. So we had really good support from our trustees. We've got very good Sarcoma UK trustees. We always have done. They've always got passion and they've always got vision, and they listen and they hear from the community, and they're part of the community and they drive things forward. So that's great. We also worked with the people in the community, so the patients and the families. What would be helpful? What do they need? What are they missing? And then we did the healthcare professionals. And that engagement has been so crucial to the support line. And by that, I mean the oncologists, the surgeons, the people in the diagnostic centres, the nurse specialists, the pharmacists in some areas, the physiotherapists. We literally, on the support line, could tell you in each of our 17 centres, the surgeon's name, the oncologist's name, the nurse's name, the healthcare professionals, physiotherapist, the OTs. We know them all. And I did that at the very beginning. I was lucky because I'd come from one of those jobs, so I knew a lot of people nationally, but then I went out to talk to them. I went to the National British Sarcoma Conference and I said, we are hoping to set this up. What do you all think? This is what we're trying to do. We're not trying to take over your roles. We're trying to help support you. We think there's a need. We want patients to feel better informed and have better support. We're going to fund it. And they got behind us. And we go back to them regularly. We are always at the British Sarcoma Conference meeting talking about what we're doing, or across Europe. We are at meeting with the nurses. We go out to the clinical teams. We try and get a visit to each of the clinical teams at least once every 3 years. So we are out visiting, seeing. We do lots of meetings with the nurses. We engage with them all the time. It's a constant thing, and we definitely could not run the support line without them. We also have, and we've constantly kept up that relationship regardless of what's going on around the landscape and COVID and everything. We work really hard to keep that relationship going. We needed really good social media and website input, and that's been so powerful, and also engaging with the healthcare professionals because they give out our information to the patients as they're diagnosed. And we also found that most of our funding for the support line side, we've been able to get through trusts and grant applications. It's an incredibly fundable service. So we also had to get our paperwork in order, which I can tell you at the time was quite a job. So we have a standard operating procedure. So we actually think, how are we running the support line? How many people do we need on it? When is it opening? When is it closing? We also have a support line policy. What do we say to people? When do we escalate things? When do we need to call people? That's very clear and very written, really we keep to it. We're very, very clear on that. We've got a GDPR policy because we store data and we need people to know what we're storing and why we're storing and what we're going to do with it. Got a confidentiality policy. We did work on encrypting our emails. That's very important. We have this thing in the UK, which is DBS, which is like police checked. So we are all police checked. So people know that when they're calling us, we are people who are have the right and the correct and the safe background, because we get youngsters call us as well. And that's really important in the UK. And we also are part of this other thing, which is called a helpline standard. So we are inspected 3 yearly to make sure what we're doing is correct and supportive, and we are clearly keeping our data safe, and we are clearly being confidential. So that's also was very important to how we ran it, because we wanted it to be a support line that would have resilience, would last a long time, and that people would see was credible, and that teams would go, yeah, they're doing a good job. I know that they're saying the right kind of things. My patients are coming back to me going, I've spoken to the support line. It's been a very good experience. We also work really hard on knowing our boundaries, and this might be a nursey thing, but we spent quite a lot of time pondering like what we are not around to do. And I think that's important when you're setting up any new service that involves people, is to be clear on what you can offer and what you definitely can't, and bringing those boundaries in nice and early and sticking to them. So we are clear, we do not give second opinions. At the moment, there are 5 people on the support line. Some people are part-time, and 4 of them come from a very sarcoma background, been clinical nurse specialists for a long time, or allied health professionals in that working environment. But we don't give second opinions. That's not what we're here to do. We are not clinicians in that sense. We will signpost for further opinions, but we're really honest about that. If people are already in a sarcoma service somewhere in the UK, it's very unlikely they'll go somewhere and hear anything different. It sometimes isn't true around clinical trials or surgery, but we're very clear with people, go for a second opinion if there is something with a question that you're asking. Otherwise, you are very likely with sarcoma to hear the same thing. We're not an acute service. If you ring up and tell me you've got a temperature and you're feeling a bit dizzy, I will tell you to put down the phone and call 999, and we were very clear about that. We also don't have any access or want any medical notes. And I'm going to talk briefly about our direct referral, and we never, ever have any clinical notes. We want to hear what the patient or the person that's ringing us is talking about, and we want to listen to that, and then we want to answer their questions. We're very clear that we know the national and the international guidelines. That's really important, so we can help inform patients. This is what should be happening. It's not happening, so this is how we can get that changed. Here is the tool, the piece of paper that says, no, this is wrong, you need to be here. We're really happy to say, and we've always said that, we're very clear, we don't know the answer to that. That's a new one on us, but let's go and see if we can find someone that can. And that's very important. We are really honest with people. Gosh, I'm really sorry, I don't know. I'll find out for you. And we also move people, and we have over the years got a bit stronger on that and a bit more ballsy, I suppose. At the very beginning, we would give people the tools to say you should be in a different place. And now our boundaries on that have shifted, and we will pick up the phone and tell clinicians who are not meant to be looking after sarcoma patients out in the middle of some other hospital that has no sarcoma MDT, that they shouldn't be looking after that patient, and that patient needs to be moved. And since 2016, we've moved 200 people that way to get them to the sarcoma specialist teams. Since we've started it and we've rolled it, we've added a different service, which is called our direct referrals. And it was offered first from a team in Wales, which was a wonderful idea. The Welsh team came to us and said, we're giving out your information all the time, and we know that you're speaking to our patients, but we think that some patients probably don't see it, or it comes in the pack, and they probably aren't the people that will reach out to the charity, that, you know, those hard to reach people. Maybe we can do it in a different way. And we went, yeah, great, let's try it. So what they have done, and are now 13 of the sarcoma teams in the UK do, is as their person is being diagnosed with sarcoma, they say to them, we are going to refer you to the Sarcoma UK support line. We're going to give them your name and your best contact detail. Is that okay? And they're going to ring you in the next 2 weeks and make contact. And they are just there as an extra support. They're just there to talk to, see if you've got any other questions. We're still here as a clinical team. They are just an extra. And that's worked really, really well. We've had no problems across the country. People have really engaged with that. And we definitely are talking to people that we wouldn't have spoken to before. There are always people that will engage with a charity, and they're going to engage with the charity anyway. They're going to find you anyway. But by having this opt-out service where the teams are saying, we are referring you, and this is what's going to happen, everybody in Wales so far has said, great. Nobody said no, which is interesting because they've been going since 2020. And what I find is I talk to people that one Welsh patient is an amazing guy. He's a sheep farmer, and he's right in the middle of Wales, miles from anywhere. And I have been talking to him, or was talking to him, for about a year. And so we do the first phone call, and then we book them in, and we call them again, and then we call them again. They can always not answer their phone. They can always not take our call, and they can always say, no, don't worry, I'm fine. But they tend not to. And we build those relationships definitely with people that we probably wouldn't have spoken to before we did this direct referral. What have we learned? Well, I think what we've learned is that the support line has had a massive impact on the charity. When we started it, we were there to go out to try and see if we could help and give more information and support patients and their families. That was definitely where it all started, and get people to the right place. But what has happened is it's brought people to us with sarcoma, and families and healthcare professionals into the charity. And so many people who have spoken to us on the support line go on to fundraise. They sit on our research panel. We have a lay research panel, and they sit on that. They talk to the communications team. They tell their stories. They go with us to government events with the policy team. And they engage all the time with our patient involvement network. And they've started their journey with Sarcoma UK on the support line. And I think we didn't really think about that at the beginning. We just thought what we could offer. But of course, people really want to engage and keep that engagement up. We've been talking to people for 8 years now on the support line. And also, it's a really unique two-way information stream, because although we're trying to provide the information the person is asking us, we are also hearing in this kind of feedback loop, what's going on, and not going on just in one specialist team. We hear from across the country. So what we're able to do is pick up on trends and on themes and kind of inequalities. Why is that service running there, but it's not running down here? And why can you have chemo there, and why can you have a scan on a Saturday, and why can you get genomics in some part of the country and you can't in others? And we take that and we take it back to the clinicians. We take it to all our leaders of the clinical teams in a SAG chairs meeting, which we do once a year now. And we go to the British Sarcoma Conference and we go, hey, this is what the people ringing the support line tell us. These are where the holes are. And it's anonymous. We're not saying an individual, but we're saying this is what's happening with our gynae patients. This is what's happening with the GIST patients. Why aren't they having genomics? Why isn't this testing being done? There's a hole in this patch of the country. We need to sort that out. And that's been amazing and a really unique. I think we're the only people that get that kind of national overview of what's going on. And every day we get that incredible feedback. So that's been wonderful, and not at all what I think we thought about at the beginning. What would we have done differently? Oh, there's so many things that you could say, but I think staffing, when we started, it was me as a nurse part-time and a colleague in the office. And staffing needs to be robust. If you're going to set up a service which is patient and family facing, you need to be there. You can't just have a holiday, be sick, because then the service doesn't work. And so if you're going to set something up, you need to be robust. And we now have 3.2 whole-time equivalents. We actually have 2 members of our team who have just retired from the clinical teams. It's a great job for people who were clinically really busy as nurses, and they are retiring from their mad, crazy job. But actually, they've got so much experience, and doing 2 days on the support line, talking and using their experience, they're loving it. It's like this new service we're providing for people who are retiring in the UK as nurses in sarcoma and physios. They want to come and work and offer their services. It's been great. We also really, at the very beginning, wanted to have an expert support line. We wanted it to be with sarcoma nurses and clinicians. We had an amazing OT that worked with us for a couple of years before she moved abroad, and we have a radiographer that is on the support line now. But people who have that knowledge, who've worked in the teams, that know how they work, is invaluable, and was so important to setting up at the beginning, to get us up and running, to get that engagement, to get out and know the teams, and to tell what we were going to do. But we also have a midwife on our now, who was a bereavement midwife, who has incredible communication skills and has an amazing bereavement background. Didn't know anything about sarcoma. Now she knows loads. She's an incredible person. So whilst we started it as being purely an expert sarcoma support line led by nurses, we've spread that out, and actually there's huge value in that. And that might be something perhaps we would do differently. I think you definitely need expertise at the beginning, but I think you can build on your expertise and bring in different people that can work with you in an amazing way. I think we would be more proactive earlier. I think we probably, if I was doing it now, I'd start with the direct referrals. Hey, listen, we can do this service. You send the patients directly to us. We want to speak to people earlier in their diagnosis. Send them directly to us. I think that would be great. We didn't think about it. We just didn't think about it at the time. And we also never used to do callbacks for the first few years. We kind of were like a bit more nervous. Well, we let people ring us if they want to. Whereas now we're like, oh, well, we'll book you in. When do you want to call? 2 weeks, a month? We can ring you next day. Sometimes we call and speak to people every day. I think if you're going to set something up like this, really think about the data that you're going to collect. And we have been doing that, but we didn't do it so well in the first couple of years. We kind of were like, oh, actually, we could do this. So we know why people ring us. We know that what subtype probably that they're going to have. We know perhaps where they are in the country, which specialist team they might be under. And we collect data sets and we anonymize them, and then we publish them, or we talk about them back with the clinical teams to share what we're learning. to hear the voice of the sarcoma community and take it back to the clinicians and go, oi, look, there's a problem here. This is what we're hearing. This is, don't communicate like this, communicate like this. Don't say this, don't say that. What about doing this? These are great ideas. And we do that all the time. And I think the other thing that we probably would do differently is we would really think about recording the impact of the support line. We've had great communication leads, and they've really worked with us. It was kind of something we weren't used to doing. But I think if you can record a bit about what the impact of any of the services that you're providing is, it's really helpful if you're then going to go and apply for a trust or a grant application, because you can say, this is what we thought about doing and we've done it, but actually this is what the community is telling us. They're telling us this is really helpful. 26,000 contacts later, they're still ringing and still emailing us. They're finding this really helpful. This is having an impact for them. And that really helps keep your service running. And I think those are the kind of things that we were a bit slow to. We were nurses. We have a different view on things. And we hadn't had to kind of do that in our roles before. But 9 years into it, we are really good at doing that and really listening to what the community is telling us and sharing that and taking that back to our fundraisers to say, listen, people are finding this really helpful. Here are some stories, and maybe this will help when we're applying for grants. So we've got much better at really appreciating what we're doing and trying to get that voice out. So that was what I was going to talk about today. I hope that I've kind of given you a little insight into the support line and also what we did and how we did it. I think we were very lucky at the beginning that we had that sign up with the clinicians in the teams. It made such a difference because they've always backed us. We can pick up the phone and say, we're worried about this. There's a patient that's trying to get to you. You know, they always listen to us. It's been such a great collaborative working pattern that we found. And that started at the very beginning with planning it and going out to talk to them and speaking to them about what we were going to do and how we wanted to do it and how we could do it together. And that, I think, has been the key to the success of the Sarcoma UK support line. But thank you all so much for listening. And please do not hesitate to get in touch with us if there's anything we can do, any advice or anything you'd like to talk through anymore. Thank you very much and happy holidays.